Acid reflux GERD. When you eat, food moves down into the stomach through a one-way valve called the lower esophageal sphincter. Normally, this valve closes tightly to keep stomach acid from moving backward. But in acid reflux, this valve relaxes too often or doesn't close properly. Stomach acid then rises into the esophagus, the tube connecting your mouth to your stomach. The esophagus lining is delicate and not built to handle acid, which causes irritation and a burning sensation in the chest called heartburn. Symptoms may worsen after meals, when lying down or bending over. Chronic acid reflux is called GERD, which can lead to inflammation, discomfort, and in some cases, ulcers. Avoiding large meals, fatty foods, and certain drinks can help reduce symptoms. Indigestion, dyspepsia. Indigestion or dyspepsia is a general term for discomfort in the upper abdomen during or after eating. It is not a disease itself, but a set of symptoms caused by slow or inefficient digestion. When food is not broken down properly, the stomach and intestines work harder, leading to bloating, heaviness, or nausea. Common triggers include overeating, fatty or spicy foods, stress, or certain medications. In some cases, it may be linked to excess stomach acid or delayed stomach emptying. Symptoms can range from mild discomfort to persistent pain, burping, or a feeling of fullness. Managing portion sizes, avoiding trigger foods, and reducing stress often help relieve indigestion. Bloating. Bloating is when your stomach feels swollen, tight, or full, often accompanied by gas or discomfort. It happens when your digestive system traps gas, either from swallowed air or from the breakdown of food in the intestines by bacteria. Foods high in fiber, sugar, or certain carbohydrates can produce extra gas, especially in people with sensitive digestion. Bloating can also occur due to slow digestion, constipation, or imbalances in gut bacteria. The abdominal wall stretches, causing that heavy, tight feeling. While it is usually temporary, frequent bloating may signal conditions like irritable bowel syndrome, IBS, lactose intolerance, or small intestinal bacterial overgrowth. Drinking water, eating slowly, and avoiding trigger foods often help reduce bloating. Constipation. Constipation happens when bowel movements become infrequent or difficult. Normally, food moves through the digestive tract, and water is absorbed in the intestines, forming soft stools. If the colon absorbs too much water or muscles in the colon move too slowly, stools become hard and dry, making them difficult to pass. Common causes include low fiber intake, dehydration, lack of physical activity, certain medications, or ignoring the urge to go. Symptoms include straining, bloating, or a feeling of incomplete evacuation. Chronic constipation can affect overall gut health and may lead to complications like hemorrhoids. Increasing fiber, drinking enough water, and regular exercise usually help improve bowel movements. Diarrhea. Diarrhea is the frequent passage of loose or watery stools, caused when the digestive system moves food too quickly or absorbs too little water. This can happen due to infections, viruses, bacteria, parasites, certain foods, or medications like antibiotics. The intestines fail to absorb water properly, so stools remain liquid. Other triggers include food intolerances, stress, or digestive disorders like irritable bowel syndrome. Symptoms may include stomach cramps, urgency, and dehydration if it lasts long. While acute diarrhea often resolves within a few days, chronic diarrhea can indicate an underlying condition and requires medical attention. Drinking fluids and electrolyte solutions helps prevent dehydration. Irritable bowel syndrome, IBS. IBS is a common disorder that affects the large intestine, causing symptoms like abdominal pain, bloating, constipation, and diarrhea. Unlike infections or structural problems, IBS is considered a functional disorder, meaning the gut appears normal but does not work properly. The muscles in the intestine may contract too strongly or weakly, and the brain-gut communication can be disrupted. Triggers include certain foods, stress, hormonal changes, or gut sensitivity. Symptoms can vary daily, making it unpredictable and frustrating. While IBS does not cause permanent damage, it affects quality of life. Managing diet, reducing stress, and sometimes medications can help control symptoms and improve digestive comfort. Gastritis. Gastritis is the inflammation of the stomach lining, which can cause pain, nausea, and a feeling of fullness. It occurs when the protective layer of mucus that shields the stomach from acid becomes weak or damaged. This allows stomach acid to irritate the lining, leading to discomfort or even minor bleeding in severe cases. Common causes include bacterial infection, like H. pylori, excessive alcohol, chronic use of pain relievers, NSAIDs, stress, or spicy foods. Symptoms may include burning in the upper abdomen, indigestion, bloating, or vomiting. While acute gastritis may resolve quickly, chronic gastritis can lead to ulcers or increase the risk of stomach complications. Avoiding irritants and following medical guidance helps manage gastritis effectively. Peptic ulcers. Peptic ulcers are open sores that develop on the inner lining of the stomach or the upper part of the small intestine. They occur when stomach acid damages the lining faster than it can heal. The main causes include infection with H. pylori bacteria, long-term use of NSAIDs, painkillers, smoking, or excessive stress. Symptoms include burning or gnawing pain in the stomach, bloating, nausea, and sometimes vomiting. Pain often worsens on an empty stomach and may temporarily improve after eating or taking antacids. If untreated, ulcers can lead to bleeding or perforation. Treatment focuses on reducing stomach acid, eradicating infections, and lifestyle adjustments to allow the lining to heal. Lactose intolerance. Lactose intolerance occurs when the small intestine does not produce enough lactase, the enzyme needed to digest lactose, the sugar found in milk and dairy products. Without enough lactase, lactose remains undigested and passes into the large intestine, where bacteria break it down, producing gas, bloating, cramps, and diarrhea. This condition can develop at any age and varies in severity. Some people tolerate small amounts of dairy, while others react to even minimal intake. It is more common in certain populations due to genetic factors. Managing lactose intolerance usually involves limiting dairy, choosing lactose-free alternatives, or using lactase enzyme supplements to aid digestion and reduce discomfort. Food poisoning. Food poisoning happens when you consume food or drinks contaminated with harmful bacteria, viruses, or toxins. Common culprits include Salmonella, E. coli, or improperly stored or cooked foods. Once inside the digestive system, these pathogens irritate the stomach and intestines, leading to nausea, vomiting, diarrhea, abdominal cramps, and sometimes fever. Symptoms can appear within hours or a few days after eating contaminated food and usually last a few days. Severe cases may cause dehydration or require medical attention. Preventing food poisoning involves proper food storage, thorough cooking, hand hygiene, and avoiding expired or suspicious foods. Hydration and rest help the body recover faster.